So it's April 24th, and as I mentioned before, I'm back in the hospital, this time doing some chemo. This is going to be a different kind of chemo because this is for my relapsed cancer. Chemo this time around is called R-ICE, with a couple of components in there that require around-the-clock monitoring for nerve damage. Before I even got to that, I just got done getting a bone marrow biopsy. 100% would not recommend, but I know it's an absolute necessity. One of the things they found in this latest PET scan were some bone lesions, and so they're trying to see how far it's spread, basically. And once I get that taken care of, I'm going to go ahead and start my R-ICE chemo, which is different than R-CHOP. There's a couple components in R-ICE that have some critical toxicities that the staff will have to be watching me for over a span of about 3 days or so. So that's where I'm going to be. I'm going to be giving as much detail as I can. I'm a little drugged up right now because of the bone marrow biopsy, but I'm hoping to be a little bit clearer for you on the upcoming videos. So I appreciate you joining me on this crazy trip. So it's about 8 o'clock at night, and after the last time that I spoke with you, they went ahead and they prepped me for a bone marrow biopsy. In this case, they're trying to see if the lesions on my bones have passed on to my bone marrow, plus my health insurance needed it. That was not a fun process, but it's one of those things where I implore you, if you need to have one done, ask for some kind of numbing agent. And as soon as you feel any pain after they give you the numbing agent, you let them know you need more. This particular facility also offers Ativan as a relaxant to reduce the anxiety, and I went ahead and opted for that too. And it made it a lot more bearable, that is for sure. I can't imagine having that procedure done without any kind of numbing agent or some kind of calming type medication. Once that was done, they actually had me get my Rituximab, or Rituxan, and they hooked in a slow drip, basically. Even though it's only been a few months, since it has been a few months, they still weren't sure how my body would react. This is a different facility. These are different doctors, nurses, and techs. And so they went ahead and they did that shortly following biopsy. And that was all in their outpatient setting. Once they were done with that, they went ahead and called to the floor to see if a room was available, and it was, and that's where I am right now. And they went ahead and they transported me over. Actually, we walked, let's be honest. My husband came and headed us off at the pass with my bags with clothes and laptops and stuff like that. I got settled in, and not long after I got settled in, the nurse gave me a heparin shot, which kind of surprised me. And so, you can't say no, it's something you have to have just to make sure that everything flows correctly. But what I wasn't expecting was how painful it was going to be. And so it didn't hurt for me to scream my head off, but it was unexpectedly more painful than accessing a port or getting some other kinds of injections or an IV put. In case you're ever in this situation where you find that you're going to be receiving R-ICE chemotherapy. So I've already had the R in R-ICE, that's a Rituximab. At some point in time, they've already done a shift change. Sometime tonight, they're going to go ahead and give me the Ifosfamide. That's one of the 3 remaining medications that they're going to offer. Now, all 3 of these medications are pretty harsh. That's the reason why this is going to be done on an inpatient basis. But this one in particular is probably one of the harshest. And they'll be doing round-the-clock checks on me, just like they did with methotrexate. So I don't anticipate I'm going to get a whole lot of sleep, which is fine because that's not what I'm here for. But they're going to be looking for neurotoxicities, anything that would indicate that I'm having side effects that are not good. They're already kind of prepping me now by giving me some saline, so to get my body used to getting things flushed out once they've done their damage, so to speak. Where the R-ICE chemotherapy fits in, I have relapsed. For those of you who are not familiar with my situation, I had diffuse large B-cell lymphoma, diagnosed October 2023, had done 6 rounds of R-CHOP, and then as of January 2024, had finished my R-CHOP, got a PET scan the next month, and was deemed in remission. And then a couple months later, while getting methotrexate chemotherapy as a prophylaxis to ensure that that lymphoma wouldn't ever spread to my brain, I found a lump in the back of my head. And that lump, which was biopsy 2 weeks later when I was supposed to do my second methotrexate prophylaxis chemo came back immediately hot for lymphoma. So it was back. To me, that seemed like the world's shortest remission. I don't even know if that's a thing. But in any case, here I am. It has gotten around to that short area in the back of my head, the left supraclavicular lymph node. There's an area just outside of my stomach. There's also some areas close to my diaphragm towards the back, and then some areas close to where my tailbone is. And then I also have bone lesions in my bone of my arm socket and in the bone of my butt bone. So it's around, and I'm hopeful that because it was such a short time between the last PET scan, which showed nothing, and then the next PET scan, which was a couple months later, that showed stuff, that I think we caught it, hopefully, early enough. So this ice chemotherapy is to keep it at bay so it doesn't overrun me, because the end result is to get me to what's called CAR T cell therapy, and I'm going to talk more about that in the next video. This video in particular is more about ice chemotherapy, because when I went looking on YouTube, I saw 2 videos from regular people like you and me. The rest of them were all from the experts, which is awesome. Sounds great, but I wanted to hear it from a person actually going through it. One person, he had done one video, and then you didn't see any more after that. Next person, she did a great video, held on to her phone the entire time. That's from 11 years ago. So I thought, maybe, you know what, let's do one that's a little bit more up to date. And so that's my intent. So depending on how aggressive my cancer continues to be, because diffuse large B-cell lymphoma is fairly aggressive, will dictate how many rounds of chemo I get before I get the CAR T cell therapy, because that in itself takes time to grow and weaponize those T cells. So that's what that's about. So here I am, just kind of chilling out. It's, like I said, past 8 o'clock. I'm waiting for them to roll in with the I in ice, the ifosfamide, and get this roller coaster started. So we'll go see what happens in the next little bit. All right. Hey there, checking in with you. So I lied. They went ahead and, instead of doing ifosfamide, they went ahead and did what's called etoposide. It's the E in our ice. The etoposide treats some kinds of cancers, and it slows down the growth of the cancer cells. And it is the fatter bag over there to the right of your screen, basically. This one is not quite as toxic as the ifosfamide, and I'm wondering if that's why they're doing this. I don't know. I'm just a patient. But what I wanted to do was just basically kind of let you know what side effects, if I do end up experiencing any side effects, occur. Let you be aware of that. Kind of like with basic, traditional, aggressive chemo, it's one of those things where because it's killing all the cells, not just the cancer cells, you're going to feel like you're not doing so well, like you're unwell. And that's one of the things they mentioned. It increases your risk of getting an infection, because it does, knock out a lot of your white blood cells. So fevers, chills, sore throat, just other symptoms you'd get with a cold or a flu, things to look out for, basically. Don't try to treat yourself. You need to also avoid being around other people. Just get yourself some medical care. It's not the same when you're undergoing chemo and you get hit with these kinds of bugs. Medication's going to increase your risk of bruising and bleeding, and it's another reason that you would have to contact your medical team. And there's other parts in here about if you are pregnant or you're planning to become pregnant, there are protocols that you'll need to take care of. I don't have those issues. I'm a little bit older. My kids are a little bit older, so I'm not akin to this, but it's one of those things where you'll actually have to talk to your care team, and they'll have to work with you on preserving eggs and things like that, so that you'll be able to have babies later on after chemo's completed. Chemo can cause infertility. That's one of the reasons why this is, it's important for you to have children, that you need to mention that that's your intent. There's some side effects that you really have to talk to the team about if you start experiencing them, or any kind of allergic reactions, which is the case with any medication, let's be honest. So itching, rash, swelling of the face, the lips, your tongue, your throat, you can't breathe. Obviously, those are bad things. You got to get a hold of somebody. Any kind of infection. So if you start spotting a fever, chills, that kind of thing, and you already know you're in trouble when that happens. Sore throat, wounds that don't heal, got that whole biopsy stitch that I still got going on, but it's mostly healed, but it's still kind of hanging on. Pain or trouble when you go in the bathroom, just being really, really uncomfortable. Those are things they want you to talk to them about. Low blood cell, red blood cell levels, and the way they kind of manifest themselves. And I had issues with this, was really unusual weakness or fatigue, dizziness, headache, trouble breathing. These are things that you got to mention to them because they can't necessarily see these things. And well, as per usual, when it comes to chemotherapy, there are some general side effects that may not be life and death-ish. Still want to mention some of them to your care team: diarrhea, nausea, and vomiting. Those are the big ones. I haven't had any issues with those at all since I've started this whole cancer journey, even back in 2023. But if you do experience those things, you do need to tell your team, because these are things that they can pre-medicate you so you don't worry about them, or they can lessen the impact if you do get them, and they can figure out other options to try to help you out with your nausea and vomiting, because you cannot afford to lose weight. Fatigue. Yep, if you get fatigued, that's kind of a standard thing. When it gets out of hand, though, when you really can't even get out of bed for days, then they might start drawing some blood on you, so if you need to get a blood transfusion or something like that. But big one for me, gosh darn it, is hair loss. I just started to grow this hair. It's almost an inch. But yeah, it looks like I'll be losing hair again, so just like traditional chemo, it's just one of those things. So I just wanted to mention that to you. Alrighty. And that's pretty much everything for right now. Like I said, this takes about 66 minutes, they said, to infuse. And I'll keep you in the loop of how things are going here. Actually, I didn't even show you guys. So that's the main door. It's a really nice hospital room. Nurses' stations over there. My pump, vital sign monitor, the bed, emesis, O2, side chair. There is a couch over there also, but the wall is nothing but window, and the bathroom. I do have 2 TVs, but let's be real. There's nothing to watch on those TVs. I actually tried to see if I could MacGyver them a little bit, try to put some like HDMI cables in there, and it would work. But then after like 30 seconds, the TV would blank out. And I think they figured out a way to make it so people can't hijack the TVs and put whatever they want to in there, which sucks because I really wanted to put like a nice little fireplace, you know, or somewhere on a beach. Oh well, that's okay. So yeah. And this is my little setup here. I've got my little side table, headphones, chargers like crazy. Got mugs, water, the most expensive Stanley Cup ever, speaker, and a laptop so I can have some good music. So yeah, that's all that I've got going on. So I appreciate you hanging out with me, and I'm going to try to keep giving you updates all along. I'll talk to you later, guys. Bye. Well, good morning. It's Tuesday, April 23rd, 2024, and basically it's day 2. So started the morning off with the usual stuff. This next infusion that I'm actually on right now is the Etoposide again. This is just like yesterday. I went before the Etoposide. Had breakfast, had the morning meds, had a different version of blood thinner. So instead of heparin, it was called Lovenox, and I got some steroids as well, so Decadron to help with the inflammation, and then I also got an antiemetic called Aloxi to keep the nausea at bay, and then later on today I'll be getting another chemotherapy drug. Not sure which one it's going to be. I think it's the Ifosfamide, and I'll talk to you about that later when it starts coming through. But other than that, it's been pretty easy going so far, and hope that it stays this way, basically. And let me know if you have questions as you are watching this video, if you're in this situation or getting ready to be in this situation, and I'll try to answer as best I can. I'm expert, not at all. Just trying to document the RI experience because I couldn't see a whole lot that was available for us out there. But so far, no adverse effects, no swelling, no fevers, no headaches. It's just been just like another day kind of thing. Just doing a little bit of a check-in. It's been a few hours, and they swapped out my chemo meds. Now I'm getting the Ifosfamide. Works by slowing down the growth of cancer cells. So I wanted to give you an idea what this Ifosfamide does, or what some of the side effects could be. Again, just like the last chemotherapy or chemo drug, this one's going to make you feel unwell, so you're going to feel kind of run down. Got to drink lots of fluids. And they are giving this with a second medication to kind of offset the toxicity that it has on the kidneys. It's got a lot of the same side effects that the last drug had also. So any allergic reactions you have to be looking out for, trouble breathing, hallucinations, that's a new one. Heart failure, heart rhythm changes, any kinds of infections you might notice, fever, chills, that kind of stuff. Again, they offset the kidney injury with another medication. I think it's called Femza or Mesna or something like that. I'll get back with you on that. And then, of course, because it's chemo, it's going to lower my red blood cell levels for sure. Probably the big thing they were saying is just to keep hydrating, which they're already helping me with, but to drink water and stuff like that too. And that's pretty much it. So that's the Ifosfamide. That's the I in the R race. I'll check back in with you guys later when I get that other medication supposed to offset this and not be so toxic. Hey, I'm back again. Just wanted to let you know that maybe in the past hour or so they started the Carboplatin, which is another chemotherapy drug. This one is going to be infused with a sister drug called Mesna to basically kind of help the Carboplatin do a little less damage to the kidneys. And so it's a 24-hour infusion, which I thought was interesting. So it'll be slowly infused over the next 24 hours. And after that one's done, and I'll flip back to the Etoposide again. And I think that'll be pretty close to what's left that they need to be doing with me. So it's been very interesting. The Carboplatin has the same number of side effects, the same precautions, the same things to be looking out for, and it's used on a multiple number of other cancers as well, including breast cancer. So it's an old school type drug. It's still doing all right. Things are going good. Just a little rundown, but that's what's to be expected. All right, I'll talk to you guys later. So I just wanted to give you an update. The Ifosfamide has finished its 24-hour drip, and so now I'm doing the Mesna, which is to counteract the Ifosfamide. So that's going to go on for a little bit, and then after that they're going to start me back on the Etoposide and just continue on. So far so good. Alright, so they've just now added the Etoposide, so now I've got 3 different bags of medication going through me right now. And so when you're hooked up with all 3 of these, the Etoposide, the Mesna to counteract the Ifosfamide from earlier, and then just regular sodium chloride to keep you hydrated. All 3 of these in unison. Basically, one of the things they wanted me to watch out for was if I have a hard time breathing. So that's something that you'll probably be looking at too when you're now nearing the end and they're throwing all this additional stuff at you. So we'll just keep at it. So far so good, just really tired.
As you can see, I'm back home. So that was last week. So from the 22nd to the 25th, I had RI's chemotherapy, and it was an inpatient stay at the facility. And I wanted to touch base on some of the side effects that I had that were different from R-CHOP. So the first one that really I noticed the most was the swelling. So I think I told you when I was getting the Etoposide and the Mesna and the Saline that all 3 of those were pumping out through me at the same time, and they wanted me to watch out for my breathing. And I was doing fine with my breathing, but you are like a Michelin man. You're all swole up kind of thing, and you're trying to flush it out as fast as you can. And it's one of the things that those nurses and techs are looking out for is your output to see that you are actually actively flushing things out, that the specific gravity in your urine is coming out the way it should with the normal levels and stuff like that. But I gained, it had to have been about 6 or 7 pounds when I was going through that infusion, just during this day alone. And by the time I got discharged, I was flushing things out well enough, those 6 or 7 pounds were gone. But it was just something of note, because I don't remember I didn't remember retaining that much fluid with RCHOP. So that was one thing I wanted to mention. And I also felt really warm. And I know I didn't feel that way with RCHOP at all. So that's just a personal experience. And you know, everybody has a different experience when they go through any kind of treatment. But I just thought I'd throw my 2 cents worth of what happened then. I also wanted to mention they did send me home with a bunch of medication. In this case, they sent me home with an antibiotic, an antiviral, and an antifungal, because my counts are so low and I have 0 capabilities right now to fight off infection. And that's something that was different than with RCHOP. I only recall having, actually I didn't have any antibiotics as far as I was aware until I got sick. And so in this case, I almost think it's a preventive effort. And I appreciate that, because this is now the next week after I've had ice, and knock on wood, no infections so far. So I wanted to mention that. Of course, they sent me home with a anti-nausea medication, a couple of different kinds of anti-nausea medication, as well as magic mouthwash. Anti-nausea medication, I didn't have to use that with RCHOP. Now, I am predisposed because I have GI issues. I don't know if it's a military thing or what, but it's just I have GI issues. And so I don't know if that I don't know if that had a part to play in me not having nausea with RCHOP. This go around, the nausea is here. It's just that queasiness, you know, and it's one of those things where as soon as I started recognizing that that's what was going on, and this was after I got home, I went ahead and I started putting myself on a regular routine with that, because I know that if it's going to start, it's going to keep going, kind of thing. So that was just my 2 cents on that one as well, because I know a lot of folks normally get nausea with RCHOP. So I'll throw that out there too. The magic mouthwash. So when I did RCHOP, that is one of the issues I really did have, were mouth sores. It was ridiculous. And I waited too late to ask for assistance. Now, that particular oncologist prescribed chlorhexidine, which is basically a glorified mouthwash, I come to realize now. What they should have probably prescribed, or what I should have asked for, and I didn't know until now, is for something that they call the magic mouthwash. And it, in essence, basically helps to protect and numb your mouth when those sores are happening. And so I got that this time around. I am so grateful. It has helped tremendously, because I am getting some sores, not as many as I had with RCHOP, but I still want to keep that at bay as best I can. The level of fatigue that I felt after ice was almost the same as the level of fatigue that I felt around round 5 or round 6 of RCHOP. It seemed to hit me harder, and when we got home, I was exhausted, which kind of sucked, because the very next day I actually had to go back to the hospital and do a full body organ function test, which part of it has to do with a pulmonary function test and a 6-minute walk. So you know that had to have been entertaining as heck. But I got it out of the way, things were fine, but the level of exhaustion is just, I've forgotten. It had been a couple of months since I've gone through chemo, and I was actually starting to get to about maybe 65-70% of normal, and it just knocked me down a peg. So the exhaustion is real, it's still there, hasn't gone away. The headaches. So just like I did with RCHOP, I'm getting headaches again with ice. It didn't start coming on until I was towards the end of the treatment, and it's continued on since I've been home now. Full disclosure, I already have a predisposition for migraines, so I don't know if that's part of it, but I do know that sometimes that is a symptom, or a side effect, I mean. It's been hard to sleep ever since I got chemo. Actually, it was like that with RCHOP as well. I couldn't sleep. I felt wired at first. I know steroids have a lot to do with it. It's just, it's the sleep cycle is off. Your body is wore out, but it doesn't want to sleep. So have a little grace with yourself if you're not used to that. And then the last thing, which is not the least thing, is the tinnitus, the ringing in the ears. I have ringing in the ears from our chop, and it never fully went away, and it just ramped up with our ice. And so it's still there. It's something I'm learned to deal with kind of thing. But if you did not experience ringing in your ears before, there's a potential you might hear it now, and I'm just giving that as a personal observation. So that's pretty much all I'm going to give you right now for this video. It's a long video already. I think it's probably the longest one I've made. And if you're here still till the end, thank you so much. I'm hopeful that the reason you're watching this is because you're looking for information. I'm hopeful you found some information helpful. Again, I only did this video because I just wanted to hear from a regular person, just the experience itself, not the scientific stuff, because the doc already told me that stuff. I wanted to know how it personally felt. And these are my 2 cents worth of personal feelings. In any case, if you found this helpful, please, I would love for you to subscribe. I hate to say it, this is going to be a little bit of a battle going on, at least for the next few months. So I would love for you to join me on this journey, and we're going to kick this thing together. If you're a caregiver or a loved one of someone who's dealing with cancer, I want to say have hope, have faith, and please don't burn yourself out, because we need you. So I want to make sure I mention that as well. And it's one of those things where we love you more than you know for taking care of us, especially when we're used to being the super men and super women. The last thing I want to say is please feel free to share this if you think somebody might benefit from it. And again, this is all opinions. I'm not a doctor, not a nurse. I'm a hospital administrator. Most of those guys don't want me talking to begin with. But I hope this helped in some way. And I'm still going to be generating wig reviews. I'm still working on that. I've just got the energy back that I could do the outro for this video. But there's more to come. And that's what I want to make sure that everybody knows. There's more to come. All right? We got this. So, as always, I hope you have an awesome rest of your day and even better tomorrow. And I'm going to see you in the next video.